member here, but delighted to take on the role of chair. And thanks to Jennifer Adam for taking that role so far and is now acting as vice chair. Thanks also to the whole team in preparation for today. A lot of work was on in the background that is a bit invisible and ahead of these meetings. So thanks to everyone. I extend my thanks to members of the public that are joining in the room today. We've got a number of people in the room in the chamber here, so welcome to you. And I believe we have a number online as well. I won't be able to see you all, but I do appreciate you taking the time to come along and show your interest in the work that we do here. So thank you for that. I continue with my welcomes. We have a number of first-time formal attendees here today. Formally welcome Willie Payton as our carers rep who's joined the IGB. This is your first public meeting. Jamie Kinlochen, who is a representative of the NHS board, well known in the area, but first formal meeting at the IGB. Welcome. And not least, Billy McLean, this is your first meeting as Chief Officer at the IGB. So welcome to all the formal new members. We have a number of new people in the room who are taking on different roles or online, and you'll be introduced as and when they come up through the meeting. So welcome to everyone. I've also you might notice the room looks slightly different today. That was actually at my request to try and bring us in. We're not a meeting of the council. We are a partnership between the health board and the council. And what I've tried to do by bringing as many people into this first row is make it much more of a partnership environment than a council chamber environment. And the name tags, don't be offended that I know a number of you for years. It just really helps that if I get slight brain fog in the middle, that I don't embarrass myself by forgetting your name for people that I've known for many years. So that's the reason for that. And I hope that helps to make the discussion flow this morning, because we are all here, I think, with a common objective of improving services here in Renfrewshire. Okay, so that was probably a lengthier welcome than you would normally give. Don't worry, you'll not always have me rambling on. Can I then check if we have apologies, Mark? I know we have a number this morning. If you could take us through, thank you.
Yes, thank you, Margaret. We have apologies from Amanda Walton, and then apologies from Councillor Adam, whose substitute Councillor Max McLaren is attending instead. An apology from Colin Neal, his substitute attending today is Paul Ryan, and an apology from Mark Ferguson, and his substitute attending is Colin Goodall.
Thank you. That formally introduces all the other new attendees today. So thank you for supporting the IGB. So can I confirm, are there any declarations of interest or any transparency statements that members would like to make at this point? Ian McMillan.
Hi there. On item 3, it mentions palliative care. Doesn't specifically name any of the local hospices, but I think it's pretty obvious who the local hospices are. And I have to declare an interest in that I'm an ambassador for St Vincent's Hospice out in Howwood. But I've done the objective test, and I don't think it rules me out from taking part in any debate. Thank you.
Thanks, Ian. I think that's helpful for transparency, but I agree, I don't think it impacts your involvement in the meeting today. Thank you. That takes us on to item 1. So we have a membership update. I've already introduced some people, but we need to formally confirm the membership of the IGB and Standing Committee. So Mark, I'll hand to you for this item.
Yes, thank you, Chair. The members will see the terms of the report. I'm not going to go through it in detail. However, first recommendation is that the appointment of Jamie Kinlochen as a Health Board voting member be noted. And the second item or second matter that arises is that the Health Board members are asked to nominate one of their number to sit on the IGB Audit, Risk and Scrutiny Committee to replace Karen Turner. Thank you.
Thank you. So I'm looking for a nomination for a member of the Audit, Risk and Scrutiny Committee. Thanks, Kath. And can I have a seconder?
Seconder.
Thank you, Paul. So Jamie, welcome to the Audit, Risk and Scrutiny Committee. You'll be under the leadership of Lisa Marie Hughes. Thank you. That takes us, so it is good that we have these regular updates to be clear on responsibilities across the IGB. That then takes us on to item 2, which is the minute of the previous meeting. I don't propose to turn the pages on the minute, but I will pause if there are any factual inaccuracies or anything that anyone would like to raise. Otherwise, I'll take silence or no hands up as approval. Pause for a second. Thank you. I'll take that as approval of our previous meeting, which was the minute of the IGB on the 27th of June this year. Thank you. That moves us swiftly on to item 3 on the agenda, which is Chief Officer's report. So, Billy, welcome, and I'd like you to introduce your report. Thank you.
Morning, thanks everyone. In Renfrewshire, we continue to deliver services in a really challenging environment, the same as the rest of Scotland, with rising demand related to demographic changes and inequality. That really means that we're going to have to do things in a very different way and move into a transformation space, and I'll say more about that later on in the report. I think despite that really challenging environment, though, the team are performing really well, and I'm delighted to be joining Renfrewshire 5 weeks in. What I can see is that we have a team that are really high performing and delivering excellent outcomes across the board. A couple of examples in the report: fewest delays in Scotland, continue to deliver on the fewest delays in Scotland, and in terms of CAMS, we are delivering 100% against 90% target. So things that I think we can be really proud of. Despite that performance, though, we do need to change the way that we are delivering services, and you can see that in there we'll be doing that alongside partners. So Transforming Together programme within NHS Greater Glasgow and Clyde is really about moving to a shift in the balance of care, improving outcomes, and moving towards a more preventative and upstream approach. And that fits well with the national landscape, where we have a number of reports out now: the Public Sector Reform Strategy, the Population Health Framework, and the Health and Care Renewal Framework, all emphasising that focus on prevention, working with people and communities, and looking at digital alternatives. So that will become a more important thread as we start to bring reports through to the IJB around the transformation that we're making to deliver the best outcomes with the resources that we have. Thanks.
Thanks for that summary, Billy. And one of the things that we have talked about is what are the key pieces of information that the IGB wants to come through in that Chief Officer's update. So that's something that we'll work on in terms of changes going forward. I have questions from the room. Ian McMillan, bring you in. Thanks.
Okay. Thanks, Chair, and thanks, Billy, for your report. And again, welcome to Renfrewshire, and I wish you all the best. Just a few issues on this particular paper. I've got 5 or 6, but I'll run through them very, very quickly. Some of them are just observations rather than questions themselves. We are undergoing a process at the moment where the council introduce charges to people who get social care from us. Now, I know that there are a number of bills that are still outstanding, and hopefully we're dealing with them sensitively, because it's taken a wee while to get to the stage where I actually charging people, though they were implemented from April. So I would just like to hear how that process is going, and if there is actually a lot of money outstanding. And although it's not mentioned in your report, I would like to mention the closure of the medical centre, or the GP practice at Lang Bank. I think that was extremely disappointing. I know it's been raised at the IGB before, and I do know that it's not our responsibility. It was the responsibility of Inverclyde IGB. But at the same time, Lang Bank is certainly in Renfrewshire. And I think that's something that we have to address as soon as possible. But to leave a whole village without a GP service, I think is poor. Not everybody can travel to alternative sites. So I think that's maybe something that we should be looking at in the pretty near future. The hospices, you're talking about palliative care. I'm glad to see that that's moving along. I have grave that's not the right word, but have concerns about the hospices and their ability to provide services, given that their money has been cut over the last few years. So I'm really concerned that they can be the major player in this kind of care. Good news still, and I say this at every meeting, every IJB, delayed discharges continue to be top of the table, and that's really good. And again, well done to all the staff who are involved in that and keeping us at the top of that table. Positive news about the education advisor being made permanent under the CAM service. I think that's a positive thing. We all know the increase in the number of young people who have been diagnosed with various disorders, so that's great to see. I think it would be remiss of me not to mention the increase in deaths due to drugs in the area. That's an ongoing concern, not only here in Renfrewshire, but throughout Scotland. Scotland had a slight dip, but unfortunately here in Renfrewshire, a slight increase, but even a slight increase is still a human being, and the impact on their family and friends can be devastating. And we spoke at the council the other day about the good work that's been going on, and some of the work is absolutely tremendous here in Renfrewshire, both across the council and the HSCP, and long may it continue. And again, towards the end, glad to see that the Carers Reform Bill has gained royal assent. That's something I think we can be proud of in Renfrewshire, about the way we deal with carers. Have we got everything right? No. Is it perfect? No. But of course, we are working very hard to provide the best possible services for our carers here in Renfrewshire. Thank you very much.
Thank you, Ian. There's a number of points in that, and I'll maybe just confirm there's a number that I think you flagged yourself there really for noting, and I'll not seek responses on them all. So your hospice concerns, I think we recognise them. I don't think you're looking for a further response on that at this stage. Is that fair? I share your keenness to flag the good news around delayed discharges. I mean, this is something that we talk about a lot, about people being in hospital that are actually better served being at home or in a homely environment. And I think, I'm looking around the room, I know that's quite pertinent to a number of people here today. The education advisor is a really positive change, so thank you for drawing our attention to that. And I think we all share your concern around drugs deaths. We do have the independent chair of the Renfrewshire Alcohol and Drug Partnership attending today's IGB as well, and likewise noting the Carers Reform Bill assent, which is a positive move. So I think in each of those, we appreciate you drawing the attention. I think there are a couple of substantive points that you probably need responses on. First of all, the council charging position and Lang Bank. So Billy, can I hand to you on those?
Yeah, thanks for those questions and comments. And I'll pass to Stuart around the Lang Bank issue, but I'll pick up the charges issue. So met with colleagues yesterday. So this is a shared piece of work between really the partnership and the council. We have different areas of responsibility around that, and it's fair to say a new process being implemented, it's definitely had some difficulties, and that's caused some anxiety for some people on the receiving end of some of those new charges who've not been used to receiving those charges. Having met yesterday, I'm assured that the process is settling. It looks like the process is certainly better than it had been, and we're continuing to work together to continue to improve the communication with people. So we have already offered open days, for instance, drop-in sessions for people to come and ask questions, and we're also going to offer those going forwards as well. In terms of some of the backlog of charges, so the retrospective charging, we're looking at how we can bring that in so that there's not as big a time lag between the services being received and then the invoice being received. So we are looking at how we improve that process overall as we continue going forward. So hopefully that answers your question around charging, and I'll hand over to Stuart to pick up the Lang Bank issue.
Yeah, thank you. So just to clarify around Lang Bank, the provision of primary care is a health board wide provision, the responsibility to provide general practice services, and there are lots of examples where branch surgeries will be provided to neighbouring HSCPs. So it isn't unique, the Langbank situation, in terms of that coming from Inverclyde. Historically, obviously, it's been a Kilmacombe practice that has had a branch in Langbank, and we haven't ever had any Renfrewshire practices that have included Langbank in their area. It is a historical situation, so it isn't new. I think the important thing is nobody in Langbank is being left without a GP service. Working with my colleagues in Inverclyde and primary care support team, we're aware that the Kilmacombe practice is an option for people to travel to, and in fact many of the residents were travelling already, because my understanding is the branch wasn't open 5 days a week and wasn't able to provide all appointments for people within Langbank. Additionally, practices in Port Glasgow, where there's good community links via bus or train routes down to Port Glasgow, is another option for people to register with as well. As part of the process, we did link with Renfrewshire GP practices and sought any potential expansion of their catchment area to cover Langbank. The only neighbouring practice would be Bishopton, which I think, as colleagues will know, has got a significant population growth with the Dargaville village development, and soon to open the Blerno Centre. And they did not have the capacity to take on an additional catchment area and associated population. And there's no mechanism for the Health Board to mandate independent contractor practices to expand their catchment area. Additionally, that can be destabilising to kind of an overall service if you to include additional catchment and associated population. So I guess for me, the sense is it's really important that the HSEP provided services link with the general practice. So if a GP surgery is provided from Inverclyde, it's important that their HSEP services link with their practices. I think we've all got slightly different services, and it is important that the GPs are able to refer to the practices that cover their population. So I think that's kind of why this situation has arisen. And I say, I think all other opportunities were explored, and my understanding is there weren't any other, both in Inverclyde or through ourselves in Renfrewshire.
Thank you for that, Stuart. Thank you. I don't see any other hand. Sorry, apologies. Linda, bring you in. Linda Gregg.
Hi there. My questions, I think, are, it sounds really good for palliative care discharge, delayed discharge and CAMS, but do we know what the service user perception is of this? Because it all looks good on paper, but I'd like to know what actually the people that are using these services feel like about it. And as the trauma-informed gender responsive training, it sounds amazing as well, but will this be across the workforce or just solely for the the alcohol and drug service? And will it be mandatory with regular evaluations, showing exactly what's changed in the way they work and doing their training? Because I don't want it to be a one-day course saying, that's me, I'm trauma-informed, and then we never look at it again. I want to make sure that it's been evaluated and kept going. And for the NHS strategic programme update, what will the virtual pathways look like for mental health, for example? And I feel that taking away actual contact with people could make it more difficult for people to help themselves out of the mental health situation. So would these pathways lead into mental health services?
Thanks, Linda. So 3 really good questions here. Bill, are you happy to pick up each of those? I've got a question on service user views, trauma-informed training, and how do the virtual pathways work for mental health services?
I'll do my best, Linda. But I might need to bring Laura in at some point, or we might need to take the questions away, but I'll try and answer them as best I can. I think in terms of outcomes, your point about outcomes is something that I'm really passionate about. We're looking at how we bring the voice of service users into everything that we do. So one of the things that, for instance, we've talked about for the IJB is having service user stories at the start of IJB meetings, looking at expanding the use of what's called care opinion. So that's like a TripAdvisor type platform for health and care services, and how else we collect those experiences. So I couldn't tell you your specific question now, but what I can say that is in a year's time we'll have better data in terms of outcomes. So that's where we're heading. In terms of the trauma-informed question, that I believe, and I'll check with Laura, but I believe is open to everybody, so all of our workforce. I don't think it's mandatory. I'm just, again, checking with Laura. I'll bring Laura in, actually, rather than fluffing my way through that one. I'll bring Laura.
That's okay. Thank you. Thanks for that, Linda. So in terms of alcohol and drug recovery services, there is some focus work going on at the moment in partnership with ADP. But in relation to the wider workforce, we're working with Renfrewshire Council and NHS GGC Board to develop trauma champions. And we're looking at that right across the workfloor. So it's at the very early stages of implementation, but really importantly, taking your point in relation to evaluating and also understanding impact to individuals and getting support, feedback from people with lived experience, because that will there further inform whether or not we're getting it right and whether we need to amend and adjust as we go along. So focus work in alcohol and drug recovery services at the moment, wider workforce at the very early stages of implementation, and that will spread out across the workforce.
Thanks. It's just I know that from previous experience myself, I know when training's not made mandatory, it never gets done. Or it gets done once and then it never gets looked at again. So I think that's why we need a strategic, like a proper plan to make sure I'd love everybody in here to be trauma informed. I think the whole workforce, it would benefit everyone to be trauma informed. So I think it's something that should go across the board, across every member of staff, and it should be mandatory and it should be evaluated.
Thanks, Linda. And you have a final question. Laura, do you want to pick up on the virtual side for mental health, or hand it back to Bill?
Okay, so once again, that's in the very, very, very early stages of implementation. It's almost embryonic, just thinking about how we can transform our services to get maximum reach. So taking your point in relation to people's needs and that assessment of what will meet people's needs. So for some people, going down the virtual pathway will be absolutely appropriate to their needs and people engage with that appropriately. For others, it may not be the way that's appropriate to meet their needs. So again, that's something we can bring back as it develops.
Thanks, Laura. Thanks for those questions, Linda. That's helpful. Lisa Marie Hughes, bring you in.
Thanks.
And apologies. Can you pause, Lisa Marie? John Traynor, I think, wants to come in perhaps to respond to Linda's question.
It was indeed. Thank you, Chair. The Education and Children's Policy Board had a report in relation to the CAMS advisor, the education advisor post at our most recent board in late August. I think it would be useful to share that report. It has a couple of comments from children and young people, voices in that. It has very positive comments from the staff who, to date, the staff are probably the main beneficiaries, because what they do is they get early help from the advisor to provide strategies to support children and young people. So most of the voices in the report are the education staff and the clinician staff, but there are voices from children and young people. And when I say the most impact, the young people are the direct beneficiaries of that advice and guidance. So I think it would be really useful if we got a copy of that report to be circulated to board members, the IJB board members.
Yeah. Thank you, John. Thanks for that. As a chief social worker, that's really helpful. I'm getting nods around the room. So I think that we don't need to table it as an IJB item, but make that available to everyone. Thank you. I see Linda nodding. I have lots of hands going up. I take Lisa Marie first, then Kath, and then Willie.
I'll be super brief. Firstly, I would agree that we should do that. I sit on the education board. The report was brilliant and already showed the impact. And I, like Linda, love seeing the user experience and reports the experience of people who actually engage with our services. So I think that would be great. And my other point is just following on from what Linda said. We have training available to us in council around things like being trauma informed, but I think having training from the perspective of what your role is, as well as the whole piece, is quite important. So I would echo that it would be quite good as a board member to have that training along with the training that's available to staff, if that's possible. And I think non-voting members might like to do that too.
Thanks, Lisa Marie. I think that's something that it's incumbent on us all to challenge being up to speed in our understanding. So thank you for highlighting that. Kath Cooney next, and then Willie Payton. Kath.
Thanks, Chair. Really, just going back into the Chief Officer's report, and you highlighted the Health and Social Care Service Renewal Framework. And it's not a question, but I was pleased to see that you highlighted in 9.4 that for IJBs, the framework reinforces the expectation of collaborative leadership and accountability in planning and delivering whole system change aligned with the renewal principles. And I think today holding that in place and in mind as we move through today's challenging agenda, I think is really key. Thank you.
Thanks for that, Kath. I don't think there's a response needed on that comment. Thank you. Willie Payton, bring you in. Welcome to our meeting.
Thank you, Chair. I'm just trying to, first of all, apologise for the present moment, just trying to get familiarised with the process here. And I'm just trying to establish what the protocol is and the running of the agenda. We seem to be on, we're going through this report here just now, but we seem to be tagging into other issues. Is it a question that for raising issues, obviously from as a carers representative, we've got many questions that we're looking to ask and put to the board, from child smile to autism to the DRC to the potential breaches at which may be for discrimination, disability discrimination for attendance of day centres. Is it appropriate to put these questions in now, or is that for later on?
I think from that list you gave, Willie, they all relate to item 7 in the agenda. Would that be fair?
Yeah.
Yeah. So can we hold those till then?
Thanks.
Thank you. Any other questions on the Chief Officer's report? I don't see any other hands. We're just noting that it really is for bringing everyone up to date in terms of the work that's been happening across the partnership. So thank you for that report. So we're noting the range of the partnership updates and the national policy updates provided in that. Thank you. That moves us on to item 4 on the agenda, the in-year budget monitoring report, and I'll hand to our Chief Finance Officer, Sarah.
Okay, thank you very much, Chair. So similar to our previous report to the IJB, we are actually in a significant overspend, as you can see in the report today in front of you. It is slightly better than what we had initially projected, which was circa 9 million for the year, and it's now reduced to about 6 million. So the reason for that reflects ongoing work that the senior management team is doing to reduce and slow down spend wherever we can. And in addition, the prescribing position is better than forecast. There's a number of areas that I would like to draw attention to, though. First of all, we don't yet have the detail on how much funding we're receiving for the pay awards for both the local government and the health board, and I think that will be probably less than we had anticipated. So the next report that will come to the committee will actually reflect what we get. In addition to that, in section 3.3, you'll see I've referenced the backdated claims in relation to the upgrade for the care at home staff, and propose that this is used from the in-year budget rather than reserves, given that the amount is not that significant compared to what we've already paid out. Then if we turn to, apologies for the number of page turnings, to section 5, I think it's really important that the board understands where we are with prescribing at the moment. It is moving very much differently to what we had anticipated for this financial year. At the moment, our overspend is projected to be about 650,000 rather than the 1.6 million. But this reflects a whole load of different scenarios which are really being very volatile at the moment. There's aggressive manufacturing in the market, there's new players entering, there's manufacturers undercutting cost, the buying platforms are all changing, and there's a global supply chain shift. However, we have been very, very much told by the Scottish Government to treat this very, very carefully, because this is unlikely to continue. So at the moment, that is our projection. And when we bring our mid-year assessment back in November, I will reflect the potential changes to our outturn on this basis. But at the moment, we are really struggling to tie down what the projections will be for prescribing. That's not just in Renfrewshire, it's right across the board. So just to highlight that point to members today. In addition, if we go to section 7.5, members are being asked to approve the movement of the non-recurring superannuation reduction of 3.3 million to the final year in order to deliver a big even position. You'll see there's a reserve there that we draw down to help the year-end position. And if members remember, this is the final year of the reduction in the superannuation from the 19.5 to 6.5. It then goes back up to 17.6. So this is the final year that we'll have that. And then in section 8, I really want to draw members' attention to financial sustainability of the IJB and the current position we're in. And members of the Audit, Risk and Scrutiny Committee will have read the annual audit report from the external auditors, who did reference yet again the financial sustainability of the IJB and the fact that we are relying absolutely on our reserves, which are being depleted very rapidly at the moment, and that cannot continue into the future. There's also a number of other things that are affecting the financial assumptions, one of which I've just related to, the prescribing one. There's also potential delays in delivering agreed savings and uncertainty on pay awards and the funding that we'll receive for them. So in light of the uncertainties, I will bring a mid-year assessment of budget pressures for 26 and 27, 28 at the IJB meeting in November, reflecting what I'll know at that point in time. Of course, that won't have the Scottish Government budget, because that won't be till the end of December, possibly January, due to the delays in the UK Government one. So I will do my best to update that and bring further updates in the new year. So really just wanted to draw attention to that fact, and that the projected gap will change depending on the outcome of that mid-year assessment, but what won't change is the fact that we are not in financial balance, and the amount of reserves we have will continue to reduce to nothing, and our ability to deliver a break-even budget will be zero. So happy to take any questions.
Sarah, thank you for setting that out so clearly. I'll come first to questions. I have Mags McLaren online. Mags, bring you in.
Hi, I just wanted to ask, given that you said there's so many things that we are unable to pin down the costs on, we're waiting for information from the Scottish Government, we need to know about pay costs and things like that. At what point do you anticipate we'll have a fairly clear picture of where we are right now? I know you've said we pretty much need to wait for the Scottish Government budget, if that's my understanding, and I just wondered when you feel we'll have a more exact idea of exactly where we are and how that's going to affect the reserves position, given there's so many things that appear to be volatile right at the moment.
Thank you, Mags. Sarah.
So even without the Scottish Government budget announcement, we do have a significant overspend, as you can see in the papers, and the drawdown of reserves reflects that. We will not know until the new year, I don't think, what the exact position is and whether any additional funding will come. If there will be additional funding, it usually is in relation to the living wage and potential national insurance payments for staff. That has not included in the past any inflationary uplifts. What I do know is that the prescribing baseline increase going forward is likely to be only 2%, which is 1% less than the current financial year. So all of this is working against us on the one hand, but we are hopeful that will be something coming from the Scottish Government. Whatever that will be will not be enough to manage the current overspend that we have and that we're projecting going forward. But we won't know that detail until later on this year, and well, hopefully this financial year we'll be able to set a budget by the end of March on that basis. Hopefully that answers your question.
Yeah, thank you.
Thanks, Sarah. Paul Ryan.
Thank you for your report. I notice your details about the reserves and the expected to run out in the next couple of years. You say you might have difficulty setting a balanced budget. Can you spell out the consequences if you're not able to set a balanced budget?
Yeah, thank you very much. So as the members will be more than familiar, we've discussed it a number of times at the IJB. What that means is that we go into immediate financial recovery. That means that essentially no new packages of care can be agreed. You have to have a hold on vacancies, that you would move to almost immediately critical only, and even then it would need to be one in, one out. It's a really, really difficult position to be in because you're not having planned spend. Everything becomes reactionary, and that's not a place that anybody wants to be in. Hopefully that answers.
Thank you. Thanks for that. I think both questions were really helpful, actually, to tease out in layman's terms what Sarah's paper describes more technically, as she's required to do, to make sure that the paper spells out in detail where we're at across all our funding streams. But in layman's terms, we have a clear picture for the end of this year, but we know that our spend rate is
Thanks, Mags. I don't have a question and I don't really have anything to add to that. I'm really just going to take the opportunity to embarrass you publicly. So Mags and I, with the exception of 2 years where I didn't sit on the IGB, have now been on the Audit Scrutiny together, I think 6 years. It is fair to say that the audit committee we inherited was quite new. It did not quite know what it was yet. We were getting audit paperwork through and it was of good quality, but it wasn't, I think, of the breadth of depth that either of us thought. So I just want to recognise in this forum, because audit do an enormous amount of work very quietly, your work, Mags, and being really diligent in making sure we were reporting on everything that we should be, that we were really looking into things, and that we we're ensuring the robustness of the work of the IGB and the HSCP. You've been really instrumental in improving it, and I think that should be recognised in this wider forum rather than just, I said it at our board, but I think it should be recognised here too. I think I have an easier job going forward with the work that you've done in your past years.
That's really kind, Lisa Marie, but we'll move on. Thank you. I'm not good with compliments, so we'll move on. I guess there's no action out of that item in the agenda, but it feeds in nicely to item 6. I say we do have the auditors online. We're not expecting them to report, but I guess they would step in if we were reporting anything that was out of sync with that discussion. So Sarah, moving on to item 6, I'll hand over to you for our annual accounts, please.
Okay, thanks very much, Chair. I won't go through the annual accounts because I don't think anyone other than me gets really excited about them. So I do understand that. But for me, this is the first time in 10 years that we have had no recommendations. So that is a huge, huge achievement for the IGB itself and my team who pulled them together. So really, really pleased with the result of it. There's some stark reading in the accounts, but you'll all be more than familiar with that. It does spell out our position at the moment and going forward. However, today you're just being asked to approve the annual accounts for signature. I can more than happy to take any questions, and Grace is here from External Audit as well, should anyone have any.
Thanks, Sarah. And to be clear, the recommendation from the Audit, Risk and Scrutiny Committee to the IGB in full membership is to adopt and approve the accounts. Let's see, Lisa Marie, bring you back in.
I don't have a question. Again, I think I've seen these accounts 5 times now before we got into this one. I don't have any question. I don't think we can let this pass without just recognising the work of the team. It's pretty extraordinary to have no recommendations. And as you've reflected often, Sarah, the work of your team now, the fluctuations that you're dealing with on a daily basis rather than, you know, £50 to thousands of pounds is enormous. And so just to recognise the work as we approve it.
Thank you very much for that, Lisa Marie. I think we all agree with that. It demonstrates good internal processes, and I know that's not glamorous, but it's really important. So thank you very much, and pass it on to the team. So we are approving our annual accounts. Agreed. Any other hands? Thank you. So those will be signed today. Thank you for that. So that takes us on to item 7 on today's agenda. And before I hand over to Frances Burns, who will be presenting this report, I probably just want to make a few introductory comments because I know this item is the reason that we've got so many members of the public here. So I think it's appropriate to recognise that and recognise the strength of feeling, and the atmosphere is quite palpable in the room. So just reflecting that for people that are online. We've already heard a lot about through the Chief Officer's report about the demographics that we're in, our complexity of the environment that we operate in, and the demands on us as service providers in health and social care. We've had the Chief Officer's update around the counter to that, which is that we are not in a sustainable financial position, that we are spending beyond our budget. And we've also had the external audit report raising concerns about our sustainability. The audit report also served as a good reminder that actually it was the whole IGB and its membership that tasked management team to go ahead and develop these proposals that are on the table today. And I say that as a reminder that we are trying to work in partnership. There is not a them and us. We have one budget. We have services that we want to deliver at the highest possible standard. And I think we have different views on how that should be done, but I think we're all in agreement that that is the sentiment that we're working towards, and we do now have the opportunity today to decide on some of those. So I just thought I would set that tone in terms of why we are at this position, and I'll hand over to Frances. I can't see because you're up here now, Frances, to introduce the paper. Thank you. Thanks, Max. As Max said, today we're presenting a range of proposals to the IGB that they originally considered back in December 24. And at that meeting, officers were asked to further develop and engage in these to gather evidence and feedback to help inform members' decision making. This process has been difficult, and as officers, we are aware of the impact that these proposals will have and that can't be fully mitigated. So we've also heard firsthand the concerns from people who use our services, their families, our staff, unpaid carers, and other partners. If savings are approved, we want to assure that officers would work with individuals and families with care and sensitivity to support them through this change, drawn on experience from previous changes, such as the recent closure of Montrose Care Home. However, as Max has highlighted, it is important that these proposals are considered within the challenging financial context facing IJBs, and that's not just Renfrewshire, that's nationally. We're seeing an increase in demand for our services at a time when funding cannot keep pace. The proposals presented today total 2.635 million. Back in December, the IJB considered 19 million of savings, and the remaining 13.8 million is being managed by officers over the next 3 years through the redesign of our internal services. And this is really with the view that we have sought continually to perfect frontline services as far as possible. Based on the current projections, further savings will be needed before the end of this financial year by March 26 to address the remaining gap. And beyond 26-27, the financial gap will be significantly greater. Should a proportion of the savings not be agreed today, this will increase the financial gap and savings that need to be identified in the short term. And furthermore, it also increases the likelihood of the IJB facing decisions that would more profoundly impact the provision of care going forward. For each proposal, as members will be aware, we've developed an integrated impact assessment, and these are provided as appendices of the report. Today, I don't plan to go through the detail of these, as I know members are very familiar with this by now. But I'll just go through the savings that we are discussing. So those are in Appendix 2, reduction of health visiting. In Appendix 3, removal of Child Smiles community and practice programme. In Appendix 4, the redesign of older people's day services model. In Appendix 5, the redesign of learning disability and physical disability day service model. In Appendix 6, the review of learning disability residential respite. In Appendix 7, the closure of plexicare. And Appendix 8, the closure of autism connections. Appendix 9, the removal of assertive outreach model. Appendix 10, the redesign of district nursing and care at home overnight service. And then within Appendix 11, we've also provided a cumulative IIA on the collective impact of these proposals. We asked members to note that the proposal for locality-based respite, which was put forward in December 24, is not included as we originally planned. And this is to allow further work on this, as we're seeking to review this across all our services and not just within the older people service, to avoid any risk of inequity in provision. So we'll bring back this at a later date. All the saving proposals, with the exception of the one relating to the internal redesign of district nursing and care at home overnight service, they have been subject to public engagement. The engagement process outlined in Section 4 of the report was agreed by the IJB. They agreed the approach we would take, and it sought to gather views and feedback on the proposals. As I mentioned earlier, there was broad opposition to the proposals, with a number of respondents noting that they felt that the savings continued to target particular service groups, although we heard this from varying service groups. Some respondents also felt that there would be knock-on impact of the proposals, and this would lead to greater downstream costs. Some feedback suggested alternative considerations for saving, but a lot of these would actually it would impact the business case and reduce the savings that we could achieve or incur additional costs to deliver. For example, there were suggestions included around reducing the number of buildings we use while retaining services, so that would cost us more money. There were a few new opportunities that were identified that we will look to investigate further, and that broadly related to how we work with wider teams and partners and how we work with the community. It was clear throughout the feedback, however, that universally people have a really positive perception of and value the staff that deliver the impacted services. They really value the services that they receive. So reflecting on the ask for the HSCP to gather the feedback to inform decision making, we haven't made any significant modifications to the proposal set out. There have been a number of minor changes and refinements to reflect some of the feedback. The most significant change that we made related to the proposal for older people's day services, where we included lunches. It was recognised that that was a really important element of the day service experience for individuals. Also, there was the inclusion of partial mitigation within the Child Smile proposal, reflecting the wider support and providing general health messaging. But the full summary of the changes to the impact assessments on the back of the engagement can be found in Appendix 1 of the report. In addition to the proposals that the IJB are asked to consider, the report also does provide updates on voluntary redundancy and voluntary early retirement process and the review of soft facilities management. It also notes the plan to refresh the current Sustainable Futures Programme Board so that it also acts as a budget working group with a view on future financial planning. And it reiterates our commitment to adopt a much more transformational approach in the medium to longer term. Thanks. Your hand up and take promotion. I will come to you, and then I'd like to get into the feedback first, and then there are questions.
Thanks, Chair. It's an amendment, and I know that you have a copy, but are you okay if I just read it out for the people that can't see it in front of them? Right. Okay.
Yeah, thank you, members. We'll take not necessarily the order we'll vote in, but we will take, in terms of items of business, recording them, the order they were received. So the first motion that has been received, excuse me, just to open it up, is from Paul Ryan. Can I just check, Paul, who your seconder is? Thank you. And I will read this out for the benefit of those who don't have any electronic access. Wayne will email both amendments through to members. I'll also put them in the group chat once I'm finished speaking. So this one says, this motion asks the IGB to review the proposals with an aim to redesign the Child Smile Community and Practice Programme in light of the concerns raised by National Child Smile Executive Team, the Oral Health Director and the British Dental Association, the high level of risk identified with only limited mitigation, the disproportionate impact on those children and families in lower socioeconomic groups, the potential increase in the number of children requiring teeth removed under anaesthesia, and bring back a paper to a future IGB meeting. The second motion is from Councillor Cameron, and that is seconded by Councillor Hughes, and that reads, While the IGB supports the strategic direction of travel of Sustainable Futures and the need for a transformational approach to deliver change, the IGB rejects the current tranche of proposals with the exception of Proposal 9, Section 5.5, Proposals 1 to 8. We are concerned that the impact of these proposals will result in greater costs for the IGB and are misaligned with the prevention and early intervention agenda. Given the UK budget has been delayed, which will impact on the timing of the Scottish budget, it remains to be clarified if IGBs will receive further funding in the future.
Apologies, my microphone wasn't on. Hopefully everyone heard. I was just asking Ian to pause if it was questions rather than amendments or motions. Can I confirm for voting members, are you all satisfied that you have access and heard the amendments that have been tabled? Just looking around the room, checking.
Yes.
So Mark, at this point, I hand to you to talk us through the next stage. Thank you for your patience. I was just making sure that we are approaching this in a sensible way to make sure we maximise opportunity for comment. So we have 2 proposals that have been brought forward. I think those are quite clear at this stage. I'm keen now at this stage, rather than voting on those, that we hear any questions. Those can then be addressed because that will help to inform any decision making that's needed on that. So if your hand is up because of a motion, put it down. If you want to raise questions at this place, either virtual or actual hands up. So I had Jacqueline, Ian, and then Willie, and I'll take it in that order. Jacqueline, thank you.
Yeah, I just wanted to speak to the motion, Mags, just to explain it a bit further. As I say, we absolutely support the strategic direction of travel of Sustainable Futures, and we know that we've got big decisions to make in the future, but a huge financial gap of £35 million. And obviously we're going to be faced with decisions that are not going to be palatable, but we're behind the change because we know that unless something drastic happens nationally, then that's what we're faced with. The current tranche of savings is something that I'm not comfortable with, or my colleague. I've worked 10 years in advocacy defending the rights of people with disabilities, 4 years in Public Health Scotland, 3 years as chair of the Fairer Renfrewshire subcommittee, and I have to look at these decisions through the lens of my own personal values about fairness and equality, and they don't sit comfortably with me. I'm looking at the people behind us, the people online, and we are looking at people in society that don't get a lot, and we have to look at fairness and we have to look at equality. When I went for my interview at Public Health Scotland, talked a lot about the Christie Commission. We've been talking about that since 2011 and we're still not there. Long way off. And we need, it's not about our IGB, it's about nationally, people need to be bold about this and look at that prevention and early intervention agenda and think about the fact that if we want a fair and just society, then we need to put that principle in motion. And thinking that's thinking about it from that angle, but thinking about it as a role as IGB members, we have to do what we think is right for the IGB. Now, I understand the financial risks and the position that we're currently in, but I think it wouldn't take much for these services. If they were not there, then the people involved, it would only take a few care packages for that saving to be gone. And I think that we could very quickly find ourselves in that position. My final point is that we don't know what's going to happen with the budgets, and we don't know what will happen in the future in terms of funding. I know Sarah reflected that it's not going to be enough, but we've got partners, and I'm conscious that partners, the board have helped other IGBs and NHS GGC, councils have helped IGBs across the piece as well. So I think that's something that we could look at for the future. We're not talking about a lot of money, but a lot of pain and a lot of change for people. So, and, you know, obviously my voice is wavering a wee bit here because it's a very difficult position for us in terms of IGB members, because we appreciate as officers all the work that you put into it, but we also, we just have to consider what's right for the IGB as well. So, yeah, not a comfortable position to be in, but that's the position I've adopted. Thank you.
Thanks, Jacqueline. I don't think there were any questions for officers in that, so I'll move on to Ian McMillan. Ian.
Yeah, thanks very much. This has been a long and difficult process which has been going on for a number of months and has caused a lot of pain, anguish, anxiety, concern, stress, you name it, for a lot of people. I do appreciate the work that's been going in. We all know, look at the size of the papers. There's a lot of work has went into this, and I do appreciate the work by officers that I know and officers that I don't know behind the scenes doing this work. So I do appreciate it. I had done an amendment myself this morning, but I very much held it back just to see what my colleagues were going to do. So my amendment was very, very similar. You'll not be surprised, but I'm more than happy to support my colleagues' motion, Councillor Hughes and Councillor Cameron's motion, and I do so for some of the reasons that you've said, Jacqueline. You know, we have the UK budget coming up later in the year, the Scottish budget, and of course we're forgetting we've got a council budget coming up as well, coming up in February as well. So there might be an opportunity for extra funding for the IGB, and it's certainly something I would be arguing for from all three parties, if you like. And I don't mean political parties, I mean the UK, Scottish Government, and here locally. I have a lot of sympathy with the motion or the amendment that's been put up by the NHS members about child smile. I did find that totally unacceptable. When I know it's been slightly changed, but I still think, given the record of oral health in this area, we can't let our performance dip on that one. It's the ramifications are too dangerous. Now, I'm not going to harp on too much. I think most people will know my feelings on some of the proposals, but if you bear with me, I'm just going to read two other people's words, if that's okay. The first one, and don't get used to this because it's not often I quote the First Minister of Scotland, but in a reply to a question by Neil Bibby MSP, he said, "The government's outlook and the policy position that we take encourage the provision of early intervention services because by supporting services of the type that Mr Bibby raises, we can invariably reduce the demand on far more expensive acute services." I think that's what Jacqueline was alluding to, while also giving purpose and meaning to the lives of the individuals who are affected by those services. I encourage the Renfrewshire IGB to consider all those questions because it is important that services and support of that type are available to all individuals at local level. Now, I was at an event last week. It was held by Turning Point, and it was to mark Learning Disability Week. And one of the service users at the Peyton's Resource Centre in Johnson gave me this letter, and he asked me to read it out. So I've got his permission. I'm not going to name him, but I've got his permission to read this out. So before anyone makes up their mind finally how they're going to vote on today's proposals, I'll just ask them if you can listen to this. There has been lots of times when people have tried to close our centres, as far back as when my mum was alive. The council don't hear what I have to say, and they hope that we go away. Why is it when money has to be saved, do they come after the things that we need and love? I can't sleep at night because of this. I want to be part of my community, not locked in my home. I am worried about the other people as well. It makes me feel like we have done something wrong when they try to take this away from me. I don't want to lose my centre. I've been there since 2004, and it is not fair that something I need is being taken away. I have not been told if there is anything to replace it or if I will get more support. The decision has been taken without thinking about us, but about money. If the centre closes, I will still be here, but I don't think they will see me. Thank you.
Thank you for that, Ian. Again, I don't think there are questions to be responded to, so I'm going to keep moving on. I've got Willie, Paul Ryan and Mags McLaren waiting, and Colin as well. Thank you. Willie.
Thanks for that, Ian. You know, you can write speeches and, you know, prepare what you're going to say, but sometimes actually just listening to people and the truth is, you know, is more hard hitting. I mean, to be honest, I mean, in nearly 50 years of my life working experience, you know, never more so, you know, than today. All I hear are the terms of review, redesign, reduction, removal, closure. These are more aligned with cries, the desperation of a failed system. Now, everybody knows we talk about money and budgets and all the rest of it, but you tell people that are starving and freezing to go on a diet and turn their heating down, especially when it comes from people who, and I don't just trying to make a mockery of any salaries or that, but people who are fairly well off, who can swan off back to suburbia, and then everybody's left in Sodorfsville at the end of it. I had a lot of questions that I was wanting to put in, like say Child Smile. There are ridiculous and unbelievable suggestions in there of who could pick that up. You know, Child Smile, at least there's another person, that's another contact for vulnerable families. You know, families that, you know, where there may be drugs or alcohol implications, but that's another member of society going into that home, you know, just that extra bit of connection, you know, that they're not getting left alone. And then I've seen reading some of the alternatives. I mean, I used to be a volunteer in the food bank, and one of the suggestions in there that the food bank could pick up some of this. People in food banks are volunteers. I mean, I can imagine myself going over to give someone who's absolutely desperate, giving them their food parcel, and say, "Oh, by the way, can I see your child's teeth?" You know, but it's proposals like that that are beyond belief. And this IGB board, you have the power. I mean, your decisions are a matter of life and death for people. And I've no doubt that decisions that have been made in the past have already probably attributed to the premature death of carers and service users. And I make no apology for that. There are other questions that I was asking through the impact assessments, the question of discrimination, disability discrimination. You want to close 3 centres and you've got 6 centres, you want to bring them into 3. How some people who, if they have family, if they live with a family or are in care, one person that's in care then gets barred from attending a centre. Direct discrimination. But to the heart, and with, I don't know if Helen's online, Helen wrote a letter, an open letter to the IGB, and just for the purpose that there's no doubt of what was in this communication. I would like, with Helen's permission, to read this out today. It was printed in yesterday's Paisley Daily Express. And what we've got John and Helen, who for 52 years have looked after their daughter Amanda. News was given to us quite recently. And what we'll do, I'll actually read out the letter that was put in. And this is from John. My wife Helen has been diagnosed with an inoperable brain tumour. Normally, we would not at this moment be spending any of our time writing to the IGB, but as parents of the 52-year-old learning disabled daughter who attends Milldale Day Services, which is on the proposals for closure. However, my wife wants to try once again to ask the IGB not to approve the following recommendations in the Sustainable Futures paper. Section 2.4, redesign of learning disability and physical disability day service model, Appendix 5. And 2.5, review of learning disability residential respite, Stage 1. We have written long and often to the IGB. We've spoken and written to officers over many years to protect the services which are so important to the learning disabled community. And it is a safe place where they're welcome, they're treated with respect, they're educated and cared for in a professional manner. It is the foundation and the scaffolding and the cared for in a professional manner. It is a foundation and scaffolding around them in a world which unfortunately is not as welcoming to them as we all wish it was. Unfortunately, we do not feel truly listened to. Over the past 3 weeks, I have had the dubious pleasure to meet with many doctors and professional health workers. And it's clear to me from this contact that too many of these health professionals, they do not listen to patients. They do not listen to patients or their families and are only interested in what they can fix. There is no interest in the whole person. We provided vital information to doctors, and to repeat this information continually. We talked openly, but no one was listening. Our situation was not unique. When I spoke with other families in the system, sadly, social care is heading the same way. The Sustainable Futures paper makes this clear. It states the following: those who fed back are opposed to the proposals with the strength of opposition made clear throughout. The perceived negative impact of these proposals on people who use these services, unpaid carers and staff, these were clearly articulated. Some respondents also felt that the knock-on impact of proposals would result in greater downstream costs. A quote from our First Minister yesterday when he answered Mr. Bibby's question a week ago today. It's clear that service users and carers with combined years of caring in the hundreds of years, John and Helen, 52 years they've been caring for Amanda. We're not being listened to. The responses of officers in that impact statement regarding those statements is no significant modifications. No significant modifications have been made to the proposals set out previously. Did they not read the impact, what people are saying? What's the point, they're asking? What's the point of an engagement process? Hollow raising of hope, simply to dash it, and then without a damn for the consequences. No one is listening. The redesign of services and the reduction of respite will impact directly on the learning disability community. There will no longer be the community that the learning disabled need to have a good quality of life. It will become an existence. This lack of interest and failure to listen will have long-term consequences for the HSPC and the NHS more generally. Carers will have to pick up the slack, the loneliness and isolation. The loneliness and isolation will follow for the learning disabled and their carers. Mental health issues will be more likely. All of this is being done to balance budgets. As I've said, no one is listening. People matter, but only if you listen and care. Money can be found. Ask Renfrewshire Council, one of the partners in the HSPC. They found between 42 and 45 million pound for the new build and the 27 to 30 million pound for the high school extension, with severe miscalculation of school capacity. Sorry, with school capacity with Dargable School. The council also have found another 12.5 million pound, which is over budget for the museum. This is over and above the money they spent for the refurbishment of the museum, and recently announced another 18.8 million pound has been allocated for a project to create a better connected route between Paisley Town Centre and Glasgow Airport. I know that these budgets come from different official streams than those of the HSPC. We understand that. However, it's galling to see all of this happen while the learning disabled community and their carers suffer from such a small sum when compared to public funds available to the council. My wife Helen, she's had an insight into the life of the learning disabled. And as the consequences of her illness, these are her words. I've been given the opportunity to dip into the world of Amanda and her friends for a couple of weeks. I hope I learned well. It's very scary. For without support of your friends and family, and in the hospital, opening a new door to a ward you don't know and having to manually adjust your brain to get back to the correct chair or bed is very, very challenging when you're on your own. A balance sheet, it's a bit of paper. Lives and the scaffolding required around some of the most vulnerable in society to help them live the best possible for them is in your hands. I hope this doesn't sound too sanctimonious. It's not meant to be. I hope it's just good common sense. Having had the opportunity for a short time to feel what it must be like to be learning disabled with a brain that doesn't work like normal people. So before we start to take votes on the salami slicing of services which Renfrewshire has been so proud to have, take a moment and think, what society do we want for Renfrewshire? Do we want the most vulnerable to lose services, cast them to the wind, and ask carers to shoulder a heavier task for their loved ones? I hope we can talk openly to you and that you listen and act with a conscience. Those are the words of John and Helen McClare. Sorry, I'm taking a breath here.
Willie, can I thank you for taking a breath there. Thank you for drawing that open letter to our attention. And I think it is useful to hear the people who have written to yourselves and other councillor members. At this stage, I'm really keen that we ensure we have enough time to hear question, debate and responses. I have a number of people waiting. So at this point, I'm keen if you have questions to raise, that you bring those to the fore and we can move on to that. Thank you, Willie.
Do you want those now?
Yes, please.
With regards to impact assessments, I'm looking at page 293. when they're looking at the National Carer Strategy. Now, these impact statements are coming from the reductions. And in that particular piece there, it says the answer, well, the reply is a possible low or negative impact. Now, how can you have a possible low negative impact to carers when the services are being reduced and therefore the carer has to take more of the slack up? It just doesn't make sense. It's also, again, on the following page, 294, with regard to unpaid adult carers strategy available. Again, positive, low, negative impact. Again, as how they can come to a low negative impact when further reductions are being made and the onus is put onto carers. Questions regarding the legality side on the community-based individuals that are in care as opposed to living in the family or living with the family. With regard to equality and rights, how is it lawful? How is it lawful to exclude people in supported living from a day centre? Has a full equality impact assessment been considered with the risk of discrimination? And I'm sure I've no need to highlight the various pieces of legislation for that. With regard to the viability of community-led initiatives, questions are being asked. What specific groups or organisations are ready right now and resourced to take on the role? How will they be funded? How will they be trained? And how will they be regulated? With regards to individual needs, how will they ensure that the activities are appropriate to those with profound needs? What does the meaning in that? If someone who is in a community-based care and therefore barred or not allowed or discriminated against to attend a day centre, what additional stimulation is going to be put in place within the care that they're in? They're going to be taken away from their lifelong friends, etc. So it just, it's just not right. Who will monitor that the community alternatives are safe and suitable? And how will existing friendship and peer connections be maintained? What has never been considered, and to understand the economies of scale, to understand financial cuts, but at no point has it ever been mentioned of a hybrid approach. There has been no pilot done. Why not? Isn't the saying, look before you jump? And what person-centred planning? These are simple questions, but at the end of the day, the importance on them should have been thought about before this paper was drawn up.
Thanks, Willie. I'll try and direct the specific questions amongst the team, if that's okay. So there's some specifics around the impact assessments at pages 293, 294. Francis, so maybe if you could direct those. There are some specifics around the community-based services, which I think probably Laura, you're best placed to bring in on that, and how needs assessments are being considered, the monitoring, friendship peer piece is all part of that planning and needs assessment, and then other models. So
I think if we take in that order, Francis, is it right to bring you in first?
Yeah, I'll bring in my colleague David just to talk about the exact wording from the impact assessments, David Fogg, and then, yeah, Laura, I think. Thank you, David.
Yep, thanks, Francis. So in terms of the section of the IIs that we're talking about there, where we've done the assessment against national and local strategies, there, I suppose, when we're thinking about each of these proposals, when we've undertaken this assessment, we're thinking about the whole range of supports that are available across the whole system within the HSCP and within our partners. And also, I think one of the points that was raised there in particular around impact on the unpaid carers strategy, the funding for that delivers support around the unpaid carer strategy is ring-fenced, and that will continue. And support from the carer centre will continue, and we continue to work with the carer centre to enable that. So there are other strands of support that are available beyond these proposals. Thank you.
Thank you. And Laura, can I bring you in the next? I think those next questions are probably all lumped together in terms of the legality and community-based.
Okay, thank you. And thank you, Willie. Thanks for sharing that information. And I would have to say, in terms of the process and the proposals that have been put forward, the officers and my teams are absolutely acknowledge what we've listened to from our unpaid carers and the people that we serve and support within Renfrewshire. So everything that we've listened to, it's not lost on us. It's not something that's wiped aside or brushed aside and we go happily on with our day. We care intensely and passionately about the support that we provide on behalf of our HSCP and value greatly the work that we do in partnership with our carers and the people that we serve and support. So I think I just wanted to make that point on behalf of myself and my team. That's certainly not something that is done without due consideration and compassion in relation to our work. In terms of the proposals, particularly I think is in relation to the redesign of learning disability and physical disability day services and related to the part of the implementation of a fair access policy that would see potential reduction in service support for people after a thorough assessment of needs, and that would be aligning with eligibility criteria of substantial and critical. And for those who have been following the papers and the discussion in IJB will recognise that officers have been asked to monitor the potential for us to require to move to critical only eligibility criteria. And with that in mind, what we have tried to look at is, albeit there would be reduction to service for some people after thorough assessment, if that was not the case, the move to critical eligibility criteria only would have a far more devastating impact across a wider range of people. So it's with that in mind that we've looked to try and minimise and mitigate the impact across a wider range of people. So inevitably, through the proposal of this position and some of the transformational aspects of it in terms of reducing service bases, integrating services and looking to provide more supports within the community, it's seen as a direction of travel that we've had lots of discussions about within Renfrewshire, but not taking that step towards, as well as meeting the needs of ensuring that we can work within the financial envelope that is available to us. So in terms of the question specifically, Willie, in relation to those people who are currently in supported living packages who do have a package of care from our provider services, and that's supplemented in a range of different ways. Over the years, those people may have attended far greater days at day services. Currently, most people attend only on a one-day basis, and that was seen as a transition from moving from family-based care into supported living, and the importance of keeping those friendships alive whilst those people explore their new lives with different opportunities available to them. So in terms of the discrimination part that you've noted, Willie, I don't believe that that's accurate. I believe that we have a duty under our Social Work Scotland Act to assess people and ensure that people have support appropriate to their need. That's something that will continue to happen as we discharge our statutory functions. In terms of the eligibility, that's within the local authority, or in this case, the HSCP, ability to ensure that we have access to our services that are proportionate to the needs of the people that we are supporting. So in terms of addressing eligibility, that's for ourselves to ensure that we have in place, and that's not dependent on a statutory function. So there are many ways in which we determine eligibility for our services. What we're proposing here is that to maintain the critical and substantial element of the supports that are very, very valued in Renfrewshire, that we need to make sure that we prioritise those in family-based support, because those people in supported living have access to a wider range of support already. In terms of any loss of day service provision that would come about through this proposal, in terms of assessments, what matters to me for those individuals and their families would sensitively be taken forward by our staff team within our community integrated team, with support providers, with individuals and with families wherever possible, looking at how we would maximise their connections to wider supports within their already existing holistic packages. Hopefully that answers.
Laura, thank you very much. Willie, thank you for raising those number of questions. That's been very helpful. I'm going to bring in Paul Ryan next.
Right, it may seem hypocritical based on the fact that I put in a motion about child smell, but I wonder if you could spell out exactly the consequences of not passing the proposals today. What you have here, I've read through all 160 pages, I'm sure we all have, and it seems to me there's some proposals here, most of which are unpalatable. But what are the alternatives? You either seem to have a mitigation process in place for 6 of them. My issues with the 7th mitigation process I'm not happy with for child smell. The other one seems to be you either have a managed approach or you go into recovery. Do we go into recovery if we don't pass this? We alluded before when I asked questions about the budget. You mentioned the consequences of that. Do you then start having to freeze care packages, people unable to get out of hospital and so on there? You have a responsibility to pass a balanced budget in the end of it'll be in March. You know that your reserves are running out in 1 year, 2 years' time. You have a responsibility, it's a legal responsibility to do that. So you either have a managed process, unpalatable as it is, or do you have widespread cuts? Now, I'm no expert on council finances, but I can just advise you, the Health Board is currently reporting a deficit of £45 million at the end of its financial year. The Health Board has no reserves. It has a legal obligation to break even at the end of the year. There is no brokerage from the Scottish Government anymore. So these are unpalatable choices. But I wonder if you could spell out the alternatives on not passing these today.
Thank you, Paul. Sarah, do you want to respond?
I think it's helpful to understand the position that the Health Board is in, and it's very similar to the Council. On Tuesday this week, Alistair MacArthur, the Director of Finance in the Council, presented his forecast over the next few years for the Council, which again shows a significant multi-million deficit, and that did not include any allocation of funding to the HSCP. So we need to make that very clear. The Council does not have resources, and neither does the Health Board. So going forward next year, it depends obviously on our medium-term assessment and also the Scottish Government budget, but we will have a significant and recurring overspend, and that is not palatable. We will then need to stop, as I said earlier, packages of care for new people. We will need to look at those in existence already and reduce them by default. We may need to move to critical only going forward. All of that starts becoming, as I said earlier, reactionary, and that's not a position anybody wants to be. You want to have planned spend, you want to have planned packages of care. It becomes very, very difficult to work in that way, not just for ourselves, but also for service users and patients as well. It's a really, really unpalatable position to be in.
And just to tease out, I think part of that question that was raised, today is not a budget setting meeting. However, by March 26, we will be legally required to set a balanced budget. Therefore, those significant ramifications that you're talking about, if we were not in a balanced position by the end of March, would in effect take effect from the 1st of April. Is that correct? So to answer the specific question, the
stopping of services and the one in, one out scenario would commence from April next year. So it is not far away, I think, is what we're all very aware of. Billy, did you want to come in on that before I go to next question?
Yeah, just to pick up on those points, there are other partnerships across Scotland that are in that position, and you can see the devastating impact that unplanned stopping of spend leads to. So in terms of freezing of vacancies, unplanned stopping of care packages, as Sarah's described, leads very quickly to large waiting list, people left in the community without the supports that they require, people stranded in hospital, which is the wrong place, unsafe for them and unsafe for the people who are trying to get into hospital behind them as well. And then the impact of freezing vacancies on the team members in an unplanned way, that is something that means that it's potluck. If somebody leaves a team, you're left with a deficit within your team. The team is scrambling around and very quickly leads to higher sickness absence, more vacancies, and a downward spiral in terms of both performance, but the motivation of teams and the outcomes for people across our services. So that is something we are really trying to avoid. Thanks.
Thank you. I'll keep going with questions because I'm keen that we address specific questions at this point before we go on to the recommendations. So next I've got Mags McLaren online.
Hi. In terms of, I just want to say a couple of things before I come on to my questions, that won't be long. I am totally supportive of the amendment, and I totally agree with a number of comments that have already been made by other participants. And I've also been lobbied incredibly heavily myself, because I'm a ward councillor, for the Disability Resource Centre. So people across Renfrewshire have contacted me about that. And I do have concerns that people with physical disabilities tend to get lumped in with everybody else in Renfrewshire and not considered separately. But taking all that to one side, one of the questions I want to ask is, if this decision were to be made today, and given the cost savings that we need to make in the longer term to bring in a balanced budget in March, is there any guarantee that these services wouldn't be revisited in the short term? Because the worst thing we could do would be to change these services and then go back and tell everybody in March they're changing again, or or even within the next 3-4 years. I think it would be absolutely awful. And given the scale of the cost savings that we have to make, I have great concerns that this is not the only change that we make to these services, and that it'd be atrocious to put people through that. I think salami slicing has been mentioned by one of the other contributors, and that would be the worst thing we could do, would be to make partial changes just now and then come back in a year or even less and say, actually, that wasn't enough, these services need to go all together, or something like that. So I think that has to be considered in making the decision today. And also, I feel there's a number of areas where we don't have information, and somebody mentioned Dargaville earlier on in the issues with the primary schools, and I do feel that we could come back and find out that the decisions we make today could only be a partial decision, that there's worse things that need to be done, and there's not enough information to know where that's going. One of the things that occurs to me is that I'd asked specifically in the run-up to this meeting if there were any adaptations needed done to the existing centres to accommodate people with physical disabilities specifically, was the question I asked at the time. And I was told all the centres were fully accessible. But more recently, just in the last week, we've been told that there are minor adaptations needed to centres to allow them to accommodate the people who would be moved to them. And we have no costings on that, no timescales. We don't know if that would be in place before people were moved, if we were to move forward with this today. And we don't know what the scale of those would be. And I don't know if there's actually any information about that, or whether that would still have to be found out. Thank you.
Thank you for those questions. I think if I hand to Billy in terms of the question around revisiting these services and then the adaptions piece, who's best to pick up? Laura, thank you.
Yeah, again, this has come up a number of times through today's meeting and I'm sure before, but obviously in terms of the demographic changes that we see those going on for the next 15 to 20 years at least. So one of the things that I'm trying to do as Chief Officer is get us into a space that starts to plan for services that are fit for the future over the next 15 to 20 years. So we need to radically change the way that we deliver services, and that will mean change across all of our services, very much in line with the public sector reform and population health and care frameworks, which is about moving resources and attention upstream, so doing more prevention work that hopefully will reduce costs further down the line, working more closely with communities. And it's been mentioned in terms of the really valuable third sector contribution to our health and care landscape, working much more closely with them and our communities. So there will continue to be changes. There will need to be. What I hope we can do is move into a space that is looking further ahead than we've been able to so far. I think at the moment we're looking at the year ahead in front of us, or 2 or 3 years ahead. I want us to really lift our heads to planning for those much longer term changes that we know are coming because of the demographics that we're facing. I'll hand over to Laura for the second part of the question. Thanks.
Thanks, Billy, and thanks, Councillor McLaren. Just in relation to adaptations, so all of the buildings that we currently use are disability compliant, and the 2 building bases that have been proposed as part of the integrated hub models are both currently used by people who have physical disabilities as well as learning disabilities. So in terms of access for people who use wheelchairs or mobility difficulties, those are already covered within our current service provision. Some of the minor adaptations relate specifically to things that we would like to have in place, or things that we would think would be conducive to supporting access to a new service for welcoming people in. So minor refreshment of paints, etc., and some things around key fob access are things that we would routinely be looking at anyway. But as part of this programme, we would ensure that in terms of welcoming people into a new integrated hub, we would build that in as part of the kind of proposal and the work. So nothing that needs significant work, but very minor things that we would look to include.
Thank you, Laura. Thanks for that update. Apologies if it looks like sometimes I'm distracted. I am getting messages online and I'm just trying to make sure that we are working truly hybrid during this so that everyone is having the opportunity. It's not that I'm not paying attention. This absolutely has my focus. I just wanted to make that clear. If I move on, Colin, you have a question next. Thank you.
Thank you, Chair. It's, again, less of a question and more of an observation. Unison have, as well as the other trade unions, have attended the many meetings that have led up to the production of these papers. We submitted a formal statement putting our view across, which was to register grave concern at the impact of these cuts, both on the public and on employees. Members of the public that use these services, as we've heard very eloquently and forcefully put from my 2 colleagues to my right here, they have certain expectations of these services. If these services are cut, where are those expectations going to be met? How are they going to be met? We've heard reference in various meetings to alternative supports and planning, but we haven't really got any detail of that. There were discussions of meetings to be held to talk about the kind of post-decision landscape if these cuts do go ahead. We're not really any further forward on that. So we still have a question on where are these service users going to go? And our concern, touching on the impact on employees, is that those service users are going to go knocking on the door of frontline services. So we don't think this is going to protect frontline services at all. It's just going to move the strain elsewhere. That then has an impact on staff, increased sickness, lower morale, just it's kind of the scenario that Billy described. And that has an impact on service delivery if you've got fewer bodies to cover the caseload. So in summation, Unison thoroughly opposes these cuts. Thank you.
For summing up, and I think that does reflect some of the challenge that is recognised in the room. So I take you're not looking for a further response on that, Colin. Thank you. I will then move to Lisa Marie Hughes, you're next, and then Jacqueline.
Thanks. Mags, and I've waited to speak because I don't have questions, but I do think it's important to speak, and I'll attempt to be brief. Obviously, I'm seconding Jacqueline's motion. I think we're in a position where there's no, it feels to me as a person who has provided services for people, who's been an unpaid carer, who is now a disabled person, who sits in this board, who cares passionately about my work as a councillor as well, it feels to me like there's no good decision here. And I want to acknowledge that it's been really painful for the people sitting behind us, but it's also been painful for the officers who are looking at this. No one wants to do this, and also people sitting in the room also have lived experience. They might be sitting there with a hat on saying they're a thing. I'm a councillor, Billy's a chief officer, Mark's the clerk here, he's actually in charge of all the legal stuff at the council. We're all sitting here with a particular hat on, but we wear many other hats, and I think we all think about these things through those things. So when I look at these papers, I am taking the decision based on the papers, but I'm also taking the decision based on things I know. I can't omit the stuff that I know from outside of this. And, you know, the possibility of going into, you know, financial measures is not something that I take lightly. The thing that sits with me and the reason that I supported Jacqueline's amendment is that I feel like if we make these decisions, we'll end up there anyway. We've got a massive cliff coming. We've taken lots of savings decisions that weren't comfortable already. But having been a person who delivered services for people who were older aged adults whose parents had eventually taken them to the point where they were in residential care, we have many, many families who are one illness, one death, a couple of hours that they don't get that they didn't get, to just handing them over to us to provide care. And for me, the amount of money that we're looking at, and I'm talking specifically about sort of the LD and older person services here, but I can come on to the other ones. For me, the amount of money that we're asking to save here could very quickly be subsumed. We've had contact from 2 people this week in terms of emails, and both of them have talked about quite sudden things that they weren't expecting that happened, that will have changed how they live as a family. But those aren't the only people I know who experience that. And I'm not talking about this as a councillor, but as a councillor, when I look at my caseload, there are families I've been working with for nearly a decade. I've been a councillor for 8 years, who I know what their lived experience is, and I have been there at the points where they're about to tip into crisis, and I've been able to help them. So in my head, I think if I know some of them, how many more of them are there that are going to tip into crisis, which removed quite a lot of these savings that we're going to make and potentially puts us in a position where we're in crisis anyway. And I don't think I'm saying anything to people in the room. No, I think officers have these questions too. I think we can't answer everything. And the thing for me, and if I look at, I mean, I agree entirely about the child smile and reduction of health visiting. I think that preventative health care is so important, and it is. In the financial situation we are in, this feels like a kind of dismissive thing to say, but the numbers that we are looking at there in terms of what they do are buttons. The thought of removing some child smile service to save £100,000 for 1 year as a saving it's just beyond me. But I do want to say I recognise the pain that is here for everybody in the room. Nobody wants to do this. We want to be in a position where we're transforming because we want to transform, not transforming because we want to transform, and also because we have to take savings. That's not where anyone wants to be. But I just wanted to reflect that I take this decision incredibly seriously. And I reckon when we were at a development session, someone, I can't remember who it was, said, taking the decision not to take the savings is also an active decision. And I just want to note to officers that I recognise that, and I also recognise your work. But morally and ethically, I feel like I can't support this in its current form. And that's not to say there aren't things that could be done around looking at things, but I think my colleague Councillor McLaren's point around the fact that if we're looking at this now, and then we're going to have to look at massive changes in the coming years, why are we creating this pain now to create more in another couple of years? Let's try to let people have their services until we need to make those changes, is I suppose where I am.
Thanks, Lucy Marie. Jacqueline, before I bring you in, Alan McNiven has sent a message just to say that he's struggling with his microphone or online, but he would like to make the point that significant pressure is being placed on local community organisation due to growing demands. He would like to suggest that as always there's an opportunity for the IGB to work even closer with the third sector, and perhaps even find ways to improve early intervention practices and develop co-design support that helps to improve community health delivery. And he hopes that we can find a way to strengthen and develop that range of local third sector partnership engagement already working well within Renfrewshire. So I just thought I'd bring that in before I bring you. So thank you, Alan. Hopefully you can hear that that's been reflected. He's apparently you're nodding. I can't see you. Thank you. Jacqueline, I think yours is the last hand. I will give those who have raised motion an opportunity to sum up before we come back in. So do you want to hold off to do that, or do you have an additional?
I've got a question, but
you have a question, raise the question, and then leave the sum up. Thank you.
Okay, no worries. No, it was just I think Lisa Marie touched on the point I wanted to ask Sarah. I mean, you know, I know as you say, it sounds glib to say a relatively small amount of money given what we're facing, but given what we're facing in the future, you know, we've got to look at 5 million savings, you know, in coming months. Are we not going to be in financial recovery anyway? That's the question I want to ask.
At present, we're not in financial recovery because we have reserves, but they will soon be fully depleted, in which case we go into financial recovery.
Yeah.
There's no button that you press that says, today we're in financial recovery. It's a position that you find yourself in because you don't have enough funding to support your expenditure.
Can I just come back, Max, because it's not quite answered the question, Sarah. My question is, if we don't go ahead with this particular tranche of savings, are we going to be in the exact same position in the coming months, is the question.
Yes, because the gap will be even greater. So we will come back with even more savings. So these don't get agreed. More difficult savings will be brought in front of the IGB because, as we've said many occasions, these were the least impacted at present. So what will come before you will be even more impactful.
Sorry, Max, I need to be really clear about this.
I think the answer is perhaps different from the question you're posing, Kathleen. Do you want to try phrasing it?
We are going to be facing these decisions. If we agreed this today, we're still going to be facing those decisions. So I think we need to be clear to the board and the public about that. We're still going to have difficult decisions put in front of us, whether we agree today or not. And I think that we have to be crystal clear about that. So it's not one or the other. We're facing both scenarios. So just to be clear about that.
And because I don't want to keep hanging back and forth. So your point is, Jacqueline, this is not the end of savings required. And I think that is important that that's made clear, because there is a remaining gap in terms of our funding versus cost of service delivery, just to put it in those balancing terms. However, by not agreeing these today, the decision at the next time when that gap is greater will be less palatable. I think that's what is being relayed. Is that fair? I think so. I don't want anyone to be under any misunderstanding in today's meeting about the position that we're in. Again, I tried to set that out at the beginning. There is not a them and us. There is a pot of funding that we are all committed to using in the best possible way. People have different views on what the best is, and that's what we're trying to work out today. But but we are in all the same position here. So I think it's just important that we're clear on that. Willie, unless it's a specific question, if it's a further statement, I probably have to draw a line, because it's really important that we get to moving on to the recommendations. So I will hold you to, if it is a specific question that needs a response, I'll take it. If it's a broad statement of background and views, I probably have to draw a line.
Okay, thank you. It was going to be both, but I understand what you're saying there. Question with regarding to legislative requirements, relevance to equality duty, which is on page 308. Sorry, I missed this out earlier. It starts, do you believe your proposed change has any impact in relation to the 3 duties under the Equality Act 2010 as set below? The response to that was yes. Then it comes on the next paragraph down, it says reasons, and then it says not applicable. Then further down, it's given reasons. Would not result in any individual being treated less favourably with respect to the article. But however, when they start off, this piece of document here, they say yes, there is an impact to the Equality Act, and it contradicts itself twice.
These are very specific responses to checkboxes within the IIA. I think the positive thing for that, I hope for the members of the public, is that everyone has been through all of these impact assessments in incredible level of detail. And so I don't dismiss what might be seen as a pernickety question that actually shows the level of scrutiny that takes place either in the room in advance. So I think actually these questions are really helpful. I think what it is drawing out is that we have obligations under these acts, but particularly around victimisation and harassment, there is nothing that would suggest victimisation and harassment. Willie, I'm going to then see if there are specifics around the further detail that we take these separately, because I think what the impact assessments show, we're under no illusion that there is impact. And there is, if every decision, whether it's made or not today, will have an impact. And there are some very few green in terms of no impact in this. So they're taking the round. Given that probably isn't going to make an overall difference in the conclusion to that piece, can I ask you to follow that up separately? Because I think it's important that we move on to the recommendations. I'm just looking around the room to agree that that sentiment.
Very quick answer.
If it's a very quick one, Mark, go for it.
Sorry, Willie, you've indicated that there's a checkbox at yes, and it then says, if yes, set out the reasons below, and you've said the answer in the check and the note below is not applicable. It's answered as not applicable under A and B. There is then a reason given under C. So there is actually an explanation as to the reason why the box has been checked as yes.
So at that, I think we'll move on, because it is. I think we'll lose the members of the public who don't want to go through at that level. But I think it's helpful to show the level of thoroughness that we've prepared for this. There are no other hands up. I think we've had the opportunity to air our thoughts, the recognising the amount of work and contribution both public and within the team in this. At this point, I get my right papers, apologies. I think we have two amendments. So I think we'll come to each of the...
Councillor Cameron, sum up.
Yes, I'm going to come to Jacqueline. If you'd like to sum up yours first, and then I'll ask Paul Ryan to do the same. Jacqueline, thank you.
Just, I suppose, reflecting what Lisa Marie's already said, that it's not been an easy decision to come to, and I've been torn in two different directions all along the way, to be honest, because of our responsibilities, and I take them very seriously. But I think it's important to point out that we have absolutely made a whole lot of savings, in the past, and we've got more to come. I also want to just say that we're the same position as all IGBs in the country, and that really a plea that nationally something needs to be done about this. And I think it was Willie that made the point that we should be lobbying our parliamentarians from all governments to take a look at the situation. The mark of a civilised society is how it treats the most vulnerable. And right now, I think we're failing them, and I think we need to do better. And I don't mean that as our IGB, I mean in general. Thanks.
Can I ask you to sum up what your proposal is?
That was a politician's speech, sorry. Yeah, so
not politicians today.
Yeah. Well, it speaks for itself. I just think that we should reject the transfer proposals today, and with the caveat that there can be work done in the background. I'm the deputy leader of the council. I'm in administration. We can have a look at things, and we've got a few months ahead to have a think about the way forward.
But your proposal accepts the recommendation at 2.9, but rejects the others, just to be clear. Okay. Thank you. Paul Ryan, would you like to summarise your?
Right. My proposal was specifically in relation to the Child Smile Community and Practice programme. Basically, it's asked to review the proposals with a view to bringing a paper back at the future IGB meeting. Why? What's so special about the Child Smile? Basically, I turn your attention to page 528 of impact assessments, all of which are amber, bar one. Also the fact that the professional advice we've had for all the proposals from the chief social worker, from the interim chief nurse, are all being support, all give assurance, with the exception of Child Smile, where we have a report from the Director of Dental Public Health expressing grave concerns. Let's make quite clear what this is not. This is not saying that children's families are exempt from savings. It's not saying that there should be no changes to the Child Smile thing. In your impact assessment, you mentioned alternatives that are being looked at elsewhere but not evaluated then. So I'm asking that this be looked at again and brought back rather than anything else.
Thank you for that. So at this point, because we have those, Mark, keep me right, we will go to a roll call vote on each of the I'm sorry. I'm sorry. I'm sorry. It's a public meeting in terms of observing process. It's really important that we abide by. I'm afraid because that's unfair on the other members of the public who probably feel just as strongly, and we can't progress through process unless I'm quite strict on that. I know that feels unfair perhaps at this stage, but I think it's important that I'm fair to everyone in the room. So I'm going to move on. Thank you. So Mark is going to take us through each of the, one being a motion, one being an amendment to the proposal, and we'll do a roll call vote based on alphabetical order of surname of voting members. Mark, can I hand to you at this stage?
Thank you, Chair. I just want to clarify where I see matters as lying in terms of the two proposals that we have in front of it. So as I understand matters, there's unanimity in the room in respect of proposal 9. So that doesn't require us to go to a vote. So the impact of the two proposals we have before us is effectively the motion is from Paul Ryan and seconded by Kath Cooney. That as a specific comment in relation to Child Smile, but as I understand matters is supportive of the other proposals within the paper. And then we have an amendment from Councillor Cameron and Councillor Hughes, which would see the other remaining 8 proposals being rejected. In their entirety, your proposal in relation to Child Smile asks for a further paper to come back on that particular item. So if everybody is clear on that, we can proceed to the roll call vote, which, as the Chair has indicated, is for the voting members and will be in alphabetical order. So if the voting members could confirm whether they are voting for Paul Ryan's motion or Councillor Cameron's amendment. Councillor Jacqueline Cameron.
Amendment.
Kath Cooney. Yes, so you're being asked, Kath, whether you wish to vote for the motion or the amendment, and the motion is Paul Ryan's motion and the amendment is Councillor Jacqueline Cameron's amendment. Okay. Yes, we're simply asking you to say motion or amendment, so if you're voting for the motion, it's motion. Thank you. Councillor Hughes?
Amendment.
Margaret Kerr?
Motion.
Jamie Kenlock?
Motion.
Councillor McLaren?
Amendment.
Councillor McMillan?
Amendment.
Paul Ryan?
Motion.
We have 4 for the motion and 4 for the amendment. There is no casting vote in the procedure, so there requires to be a brief discussion with the Chair as to how she wishes matters to proceed. We'll have a short adjournment for, say, 5 minutes. Thank you.